Americans pay 2 to 3 times more for our medications than people in other countries. Hi, I'm Patricia Kalmar, Senior Director for Healthcare Campaigns for PIRG, the Public Interest Research Group. We're working on a campaign to lower prescription drug costs. Big drug companies abuse the U.S. patent system in order to keep lower-cost generic drugs from ever making it to our pharmacy shelves. Patents prevent other companies from selling generic versions of the drug.
Generic drugs are drugs that can be produced by more than one company. And when you have a product produced by more than one company, you have competition. And competition brings down prices. That's economics, that's evidence, and that's common sense.
Drug price spending will increase by 63% in the next decade. These rising prices are causing a lot of stress for American families. 1 in 4 cannot afford their prescription drugs.
As a clinician, it's sometimes we're not even aware when a patient's not taking a drug. They may not be willing to admit that this costs too much, and we find out later their condition is not well controlled and find that cost was a big barrier for them.
When one generic drug enters the market for a particular medicine, prices drop 40%. And when lots of generics are available for that drug, prices can come down 80% or more.
There are 3 powerful weapons that drug companies have for extending their monopolies and ability to charge monopoly prices. Those are creating patent thickets, paying to delay generic entry, and hopping from one drug product to another. Turning to the first, patent thickets, pharmaceutical companies create patent thickets by getting lots and lots of patents. There's so many patents that another company can't really set foot in that space. And when there's only one company that can make a product, they can charge as much as they want for it.
Humira is a great example of this thicket of patents. Humira treats many types of conditions, rheumatoid arthritis, ankylosing spondylitis, Crohn's disease. If we exclude the vaccines that we've had for COVID, Humira is the most profitable drug ever. The first patents that relate to the product were filed around 1996, which meant technically the patent should have expired. You get 20 years for a patent. It should have expired in 2016, but it didn't. Once the drug was approved in 2002 by the FDA, they went on a patent spree. Some 12 patent applications, of which, to our count, 165 had been granted. And so come 2016, when we think we should be getting competition, we don't. And what's even more significant is AbbVie has made over $100 billion post that main patent in 2016 expiring. And they also increased the price in the end of 2002. The drug was priced at $523. In 2016, the drug price was $1,870. By the time competitors are going to enter, the price of the drug is $3,167. And this is not just an AbbVie problem. This is a pharmaceutical industry problem.
In other games, drug companies engage in what's called pay for delay. A brand drug company pays a generic something of value. In exchange, the generic agrees to stay off the market. Everybody benefits except for the consumer.
Here's an example. The drug company Endo had a patent on Lidoderm, a medicated patch to treat shingles. When another drug company attempted to enter the market with a generic version, Endo wanted to protect its monopoly pricing. The 2 companies made a pay-for-delay deal in which the competitor agreed to delay selling its generic drug in exchange for compensation valued at about $250 million. Both companies made money, but patients lost out.
Product hopping is a strategy that prevents patients from getting generic drugs that are much, much cheaper when they become available. So you might have been prescribed a drug that was patented and produced only by one brand for years. That patent is about to expire, which means the cost of the treatment could go down by thousands of dollars. Your copay could go down from $100 to $2, the enormous price difference. You go to the pharmacy with the same prescription you've been taking, and once the generic product is available, The law allows the pharmacy to automatically replace it with what will cost you less money. To prevent that from happening,
drug companies make minor modifications of their existing drugs. For example, producing a 20 milligram pill instead of a 40 milligram pill. The companies then introduce this as an entirely new product, pushing doctors to prescribe the new product, maybe even removing the old one from the market altogether. Now there's no market for the old drug, and the generic can't enter the new market because it's protected by a patent.
34 million Americans know somebody who can't fill a prescription or have died. That to me shows me there's a significant problem, and it's affecting all of us.
Our insurance companies are having to pay extremely high prices. They can't encourage us to use a generic drug because there is none. Those costs are then passed on to all insured people in the U.S. We have a lot of government programs that are paying for these drugs as well. Medicare and Medicaid are paid for by our tax dollars. So every time a drug price goes up, that means either our own pockets are affected or our tax dollars are affected.
If a patient is looking for a cheaper version of a drug and it's available, I have very little reservation on doing so. I think that's in their best interest. It's in the best interest of our healthcare system.
To change the patent system so that it serves everybody, we need to make sure that more voices, more people who depend on patented technology are part of policymaking too.
Competition is the backbone of the American system, but we're not seeing that in the market for medicines.
We're calling on decision makers to address the problem of the high cost of prescription drugs. And one key way to do that is to look at how our patent system is being abused by drug manufacturers to keep lower cost generics off the market.